That puffy triangle just above the base of your penis is the suprapubic fat pad. In some men, it becomes oversized, usually due to genetics. While it can also happen to skinny guys, a GEFP gets worse with weight gain. This overly swollen fat pad causes concealment or partial coverage of a section of the penile shaft, making your fun bits appear smaller than they really are. It also interferes with the depth of penetration that can be achieved during sexual activity. The other problem with a genetically engorged suprapubic fat pad is that all that extra bulk weighs down on the dartus muscle and weakens it to the point of detachment. Like we talked about before, that detachment sets in motion the body's reabsorption of the penis. Guys with dad bods or linebacker builds tend to be most susceptible, but a GEFP can occur in any body type. For anyone with a GEFP, it can be a humiliating feature of their physique. Many men report experiencing depression following a diagnosis of GEFP. The identification and postulation of GEFP have been attributed to both Kenneth J. Carney, MD, co-founder of Rejuvall, and several of the board-certified urologists who have received training under his GERS Urologic Fellowship Program. In fact, a recent study on this topic was published by one of Dr. Carney's close colleagues. Around 95% of cases of GEFP are caused by heredity, and while weight gain definitely makes it worse, once you tip the scale past the point of no return, no amount of weight loss can get rid of your GEFP. So what can you do about it? Cosmetic procedures like liposuction can provide some temporary relief, but a GEFP really ought to be treated by a highly skilled and specialized urologist, since GEFP is in fact a urological condition that results in the reabsorption of the penis back into the body if left untreated. Rejuvall's chief medical officer, Dr. Kenneth J. Carney, happens to be widely recognized as one of the most accomplished genitourinary reconstructive urologic surgeons in the world. Dr. Carney is also well known as a leading authority in the field of reconstructive urology, specifically in relation to reconstruction and major abdominal cases. As the founder and director of the only fellowship program certified by the Genitourinary Reconstructive Surgeons, or GERS, Dr. Carney trains other urologists who are already board certified in the intricacies of reconstructive and plastic urology. What would you guess is the #1 cause of turtling syndrome? You probably won't get this one right. The most common cause of turtling syndrome for men is having had something go wrong when they were circumcised shortly after being born. Believe it or not, this is a common occurrence and can cause a whole host of problems, which is why it's #1 on our list. So why are neonatal circumcisions even performed in the first place? Circumcision is one of the earliest recorded surgical procedures, dating all the way back to ancient Egypt. In the Jewish community, circumcision remains a religious rite and is typically performed by a mohel on the 8th day of life. About 1/6 of the world's male population is circumcised, with 80 to 90% of the population of boys in the US having had their foreskin removed. Medical concerns, such as phimosis, are usually cited as the reason for circumcision at birth in Western culture. Clinically speaking, there is an enormous difference between a bad, problematic, and imperfect circumcision. Problematic and imperfect circumcisions are rarely considered for study since conditions such as reduced penile flaccid size are not considered any form of medical diagnosis. Studies show that the method used doesn't have as much to do with problems after circumcision so much as the lack of skill. Our own research at Rejuvall reveals circumcision imperfections could be a medically divined source for reduced penis size in up to 70% of all US men. Let's say that most bad circumcisions were addressed soon after birth. Most adult men who suffered a bad circumcision would have no idea that it ever happened. Complications from a bad circumcision would include things like bleeding, pain, inadequate skin removal, and surgical site infection. Other more serious complications could mean cordy, glandular necrosis, and glandular amputation, as well as significant bleeding in those with coagulation disorders. Problematic circumcisions are addressed later in life and include complications such as penile adhesions, webbed penis, epidermal inclusion cysts, suture sinus tracts, cordy, inadequate skin removal resulting in redundant foreskin, phimosis, buried penis, myotitis, and meatal stenosis. Now, any version of circumcision, including the ones we just mentioned, that causes a measurable reduction in shaft skin mobility or skin deficiency would be considered an imperfect circumcision. Our research shows up to 70% of US men suffer effects of reduced skin mobility, and that condition affects both flaccid and erect penile size. Whether a circumcision is defined by a medical professional as bad, problematic, or imperfect, these issues will necessitate clinical care for patients to resolve. Most issues caused by flawed neonatal circumcisions, resulting in turtling syndrome, can be repaired with non-surgical procedures, and some can be performed in conjunction with other male enhancement procedures by a skilled, board-certified reconstructive urologist. Procedures performed by non-specialist doctors will only make the condition worse. Penile turtling is when a man's flaccid penis becomes very small and resembles the head of a turtle poking out of its shell. Penile turtling is often a source of embarrassment to men when naked. It is acknowledged that the girth of a man's flaccid penis plays a significant role in a man's positive self-image. Each day, a man's flaccid size varies in length and thickness. Changes in temperature and emotions, along with use of certain prescription medications, affect penis size throughout each day. In response to a signal from the body's sympathetic nervous system, the cremaster and dartus muscles contract the penis, making it appear smaller. Turtling syndrome, in which the penis persists in a smaller state when flaccid, is not a natural condition and is associated with 5 distinct medical diagnoses that are all treatable with Rejuvall. Reach out to us today to learn how we can help you overcome turtling syndrome and start to come out of your shell in a big way.